boxes. Vegetable and seed oils are in everything. And you're like, why did they, there's like no reason for it to be in there. And so avoid vegetable and seed oils, which basically means avoiding processed food. Use animal-based fats, butter, lard, tallow, and then the fruit oils, the minimally processed oils like olive oil, coconut oil, and avocado oil. And the only caution there being a lot of the olive oil, especially that we get here in the U.S., is actually cut with vegetable and seed oils. Vegetable and seed oils are cheap, so the food industry loves them. You got to make sure you're getting real olive oil if you're using olive oil. And then, once you eliminate the processed food, now you can eat when you're hungry and eat until you're full. You can actually trust your body's signals, and you're going to find you're hungry a lot less often. Going back to this, if you're trying to eat all that protein, if you have, a pound of ground beef at a meal, you're not going to be hungry for 24 hours. I can guarantee that. If you have the 18-ounce steak, you're not going to be hungry for quite a long time. So, eat more protein, get hungry less often, and, then you can kind of trust your body to guide you here.
Can you give us an idea how much meat you eat?
So yeah, on an average day, I eat probably between 2 and 2.5 pounds of meat. And I do it in, I usually eat 1 to 2 meals a day. But again, I had my day today. I woke up. I put in my coffee. So my coffee, I put salt, and I put coconut oil, and I'll use like a beef protein powder. So I put, that was in my coffee this morning. I finished operating and, had some lunch at about 2 o'clock, and that was, today it was like a pound of lamb meat, and then maybe I'll eat a little bit later. I'll have some of that stuff, which is so good in the back. But yeah, I typically, I eat, between 1.5 pounds and 2 pounds of meat most days. I usually throw in a couple of eggs. I'll eat probably, on an average week, I probably eat about 12 to 1.5 dozen eggs. I eat lots of eggs. And then, I'll mix in some other stuff. I vary my meats a lot. I eat a lot of seafood. I eat a lot of eggs. I use butter, and I use beef tallow to cook with.
Do you eat a lot of vegetables?
No, I have hardly any vegetables. I do mostly the carnivore version of low carb.
Have you been doing the carnivore since 2015?
I've been carnivore for 4 years now, and I've been low carb keto since for coming up on 7, almost 8 years now that I started low carb keto. I kind of evolved to carnivore, but what's great about carnivore is it's just so simple. Mm-hmm. You're not like tracking, you're not counting. It's literally eat when you're hungry, eat until you're full. Go home, grab something out of the fridge or the freezer, you throw it in a pan for a few minutes, you're ready to eat. There's no cleanup, there's no waste, there's no recipes. There can be, so one of my friends, her name is Maria Emmerich. She's written, she's a chef and cookbooks. She has a carnivore cookbook. And I'm always amazed. I'm like, Maria, what'd you put in here? But she's got all sorts of amazing carnivore recipes. You can make waffles that are carnivore. They're called chaffles, and you make them with
I don't even know if that's
it's amazing. You make them with cheese and eggs, and you make a waffle, and so you can do a lot of creative things with meat these days. But yeah, so I do mostly carnivore. Not that everyone needs to. It's just what's simplest and what works for me, and so that's what I do. But in the book, I actually go through all of it. You can do this as a vegan if you want to. Very difficult, but you can. You can do it as a carnivore, and you can do it lots of ways in between. Keto, Mediterranean, paleo. They all work. The general rules I give people, so first and foremost, you have to be eating real food. The second is, if you are not metabolically healthy, if you are insulin resistant, your body can't process carbohydrates. So the more insulin resistant you are, the lower carb you need to go. And again, keep in mind, when people are saying low carb, the average, the food pyramid, if you're eating according to the food pyramid, you're gonna get 300 grams of carbs a day, easily, probably closer to 400. So, going lower carb can mean eating 100 grams of carbs, which is still a pretty good amount of carbs. 50 grams is probably a reasonable cutoff for a true low carb diet. And even 50 grams of carbs, you still, you're eating carbs. Now for me personally, what I found was when I was eating a little bit of carbs, I still craved carbs all the time. Once I eliminated them, once I went carnivore and they were out of my system, then I don't crave carbs anymore. So that's another reason I like carnivore so much, is that it just, it's not even a food group to me anymore. I just eat carnivore and, it's easy and simple.
So you feel like ordering, say, off that website, that lipoprotein insulin lab, to determine if you are having some insulin resistance would give you a good indicator?
Yeah, so there are, hold on, let me pull up one of my other presentations. So there are a couple of ways to determine insulin resistance. This is actually, I gave grand rounds on Friday, and I think the recording is somewhere on the website. Sorry. That slide always delays. So, there are a number of ways to determine insulin resistance. Here we go. So the first, cheap and easy, if all you have is a lipid panel, a cholesterol panel, divide your triglycerides by your HDL.
Okay.
If that ratio is more than 1.5, you're probably insulin resistant. It's just a screening test, but it's where to start with. This is the LPIR test. Again, you can go to ownyourlab.com. So what it actually is they look at the size of your lipid particles, and it's an algorithm that determines if you're insulin resistant or not. And it's going to give you a score, somewhere between 25 and 75 is probably the high end. Anything more than about 40 means that you're insulin resistant. You want it to be ideally under 25. So that test, like I said, $47 or so on the website, and you can figure it out. The other thing you can do is if you just have your glucose and your insulin level. So again, fasting insulin level, $8. Glucose, is going to be on your basic metabolic panel, which I think costs $3 on the website. And then you can use, it's called the HOMA-IR formula, HOMA-IR. It's just your glucose times your insulin divided by 405. And again, if you're over 2 on this scale, it means you're probably insulin resistant. The real test for insulin resistance, we don't do it anymore. It's more of a laboratory study. It's called, there are 2 versions of it. So one of them is called the hyperinsulinemic euglycemic clamp. So this test, this is a crazy test, but this is what they used to do. This is what Dr. Reven was doing when he was figuring out insulin resistance. You put an IV infusing insulin into one arm, and you put an IV infusing glucose into the other arm. And you turn on the insulin first, basically. And you need to get your insulin level, you need to be putting enough insulin in through the IV that you suppress the body's production of insulin. So now you have a fixed amount of insulin going through the system. And then you start, you're measuring the patient's blood sugar the whole time, and you start infusing in glucose to get their blood sugar to level off, to stabilize. And so what this is actually testing is how much insulin you're putting in, and you now can figure out how much glucose you need to put in to keep steady state glucose So that means that your body is disposing, the more glucose you're putting in, the more glucose your body is getting rid of, which is what insulin is supposed to do. So the less glucose that you have to put in, the less your body is actually responding to the insulin. So that's how you truly determine insulin resistance, but like I said, it's a very impractical test to do. There's what's called the Kraft test, so oral glucose tolerance test. All you women are certainly familiar with it, anyone who's been pregnant. You drink a solution of sugar with a known amount of sugar, and you track the patient's glucose. The way that it's supposed to be done is you check it every 30 minutes for 3 hours. We use a shortened version of it today, the 2-hour oral, where they just check you at 2 hours. But you check your glucose every 30 minutes for 2 hours, and you see your glucose response. And if any of those sugars are over 200, you're diagnosed with type 2 diabetes or gestational diabetes. But if you take it a step further and you measure your insulin while you're measuring your glucose level, you can now determine if you're insulin resistant. So this Joseph Kraft was a pathologist actually who developed this test. It's called the Kraft test. The normal response is your glucose, your insulin level should go up, to about 50 or so. This is giving 100 grams of glucose. And then within 2 hours, basically, it should come back down to baseline. And then your glucose comes back down to baseline. If it takes more insulin than that to get your glucose down, that means you're insulin resistant. If the peak is delayed, your body is basically slow in releasing insulin, it means you're insulin resistant. Or if you start with a high insulin level at baseline, and then you get the delayed and hyperinsulinemic response. So these are all insulin resistant. So Dr. Kraft looked at 4,000 patients that came in for oral glucose tolerance tests. By the oral glucose tolerance test alone, about half of the patients were diagnosed with diabetes and half were normal. The red is diabetes, 53%, 47% was normal. But then if you took that 40%, 47% that were normal, and you looked at their insulin levels, what he demonstrated was basically only 15% of these people were actually insulin sensitive. So again, when you really test for it, most people are insulin resistant. And this gets back to heart disease actually, because there was some data from Dr. Reeven's colleagues that looked at people coming in with heart attacks. And so you say LDL cholesterol. Well, if you're paying attention to your patients who I've operated on or they came in with a heart attack, you'll notice that pretty much half of them have low cholesterol levels and half of them have high cholesterol levels, whatever cutoff you want to use, 120-ish is typically our cutoff. If you check for insulin resistance in patients coming in with heart attacks, and this is what Dr. Reeven did, 95% of them are insulin resistant. So insulin resistance is the root cause of heart disease. Cholesterol is actually our body's repair mechanism. So what really leads to heart disease is when we become insulin resistant, there are a couple of different pathways that this occurs by, but we either get high sugar levels, which damage our blood vessels, or hyperinsulinemia by itself can damage our blood vessels, and it alters our cholesterol to make it more atherogenic. It causes inflammation, it causes high blood pressure, all of these things that lead to the blood vessel damage. The cholesterol is then the repair mechanism that the body sends to repair the blood vessel damage, and that's how we got to where we are, because we looked at these plaques and we said there's cholesterol in it, and the cholesterol must be the problem. And that's basically like, again, an analogy that a good friend of mine uses to explain all this is, imagine you're an alien, looking down on the earth, And you notice that every time a building is on fire, there are firemen next to it. And you say, well, those guys must be setting the buildings on fire. And that's basically what happened with cholesterol. You know, we found cholesterol in the plaques, and we said cholesterol must be causing heart disease, and there's cholesterol in the food that we eat, so if we eat less cholesterol, we're gonna have less heart disease. Hasn't worked out so well, you know, as the data shows, so.
Have you seen a lot of cases be reversed with the CAC score?
So I now have my telemedicine practice that I work with people on, and I routinely see the score stop getting worse, and I occasionally see it getting better with, you know, mostly diet and lifestyle. There are some supplements that can help with this, vitamin D, vitamin K2. Vitamin K2 in particular is very important in regulating where the calcium ends up in our body, whether it ends up in our bones or whether it ends up in our blood vessels. So vitamin K2, only found in animal products or taken as a supplement, very important and probably helps with some reversal. Magnesium, there are a couple of other things that I'll usually recommend. But the first and foremost is address the insulin resistance, reverse the insulin resistance. That will usually, at a minimum, stop the progression of the coronary artery calcium. And in some cases, you know, we can see reversal.
If you're eating consistently carnivore, would you recommend still getting a test, or do you think it just kind of?
Yeah, I would still, there are some people who are, doing low carb carnivore and they're still insulin resistant, and that can be for a number of different factors. The other life factors, how much are you active, how much sleep are you getting, how's your stress level? There can be other, sometimes, again, what we say we do and what we actually do, don't line up, and they're like, oh, well, once a week I'm cheating, or, but then it's really like, 3 or 4 times a week, and, or, one of the other mistakes, is they don't know about the vegetable and seed oil thing, and they're cooking like, their meat in vegetable and seed oils, or, so it's still good to look for it. But for the most part, yeah, if you're on a very low carb or a carnivore diet, you're going to reverse your insulin resistance. Now, how long it takes is also going to be a thing. If you've been insulin resistant for 30 or 40 years, you've been type 2 diabetic, and you've been, on medications for all these years, it's going to take a long time to reverse that. And in some cases, you might not be able to fully reverse it, and yeah, sometimes it is necessary to stay on some of the medications. But most of the patients that I work with on my telemedicine practice, they get off their diabetes medicines, they get off their high blood pressure medicines. These are reversible diseases. There's a company called Virta Health, VIRTA Health, that has kind of done this at scale. They've shown 60% reversal of type 2 diabetes at 2 years with a low carbohydrate diet, basically.
My kids are practically carnivore with some fruits. They're little, they're 5, 6, and 10. I believe in it and everything else, but like, obviously they're my kids, so there's some concern there, but they're physically active, they're, healthy, they're thin, they're fit, they're, there's nothing, is there anything to possibly look out for or watch with kids, or is it?
No, so I have no concern with kids and low carb diets or carnivore diets. Again, ancestrally, this is the diet we ate. Fruit, if you are metabolically healthy, if you are insulin sensitive, fruit probably isn't an issue. Yeah, it's sugar, but it's real sugar. It's whole real food. You're not drinking the sugar. Fruit juices I have a problem with. Fruit I don't have a problem with if you're metabolically healthy. But if you're not, your body doesn't differentiate between the sugar coming from the fruit and the sugar coming from the candy bar, and it can't handle either one. But for a kid who's presumably metabolically healthy, now again, kids and metabolic health, big issue. We know the childhood rates of obesity, type 2 diet. We now have 8 and 9-year-olds being diagnosed with type 2 diabetes. Very concerning, because because those are the 30-year-olds that end up on my operating table now. You know, and that's a big problem. And metabolic health amongst our kids is a major thing. So great job, carnivore plus a little bit of fruit for a kid, perfect.
Now, you said appearance doesn't always dictate metabolic health.
Yeah.
Would you still have them lab tested?
Probably not,
Just-
you know, so, you know, when we look at, you know, when do we start getting metabolically unhealthy? You know, 20s and 30s for the most part. You know, certainly if a kid's obese, you want to be concerned, but a kid that's not obese, I probably wouldn't be worried about it. Now, you know, if they're getting blood work drawn anyway for some reason, you know, asking your doctor to add on an insulin test, you know, and make sure that their insulin level isn't high wouldn't be unreasonable. But, you know, I don't think, it's probably not necessary to, you know, specifically check them. You know, there are some other tools we can use. Continuous glucose monitors are great tools for metabolic health. I use them with all my patients. Again, you know, it's one of these things, insurance won't cover them, but, you know, these days it's like $75 for a 10 or 14 day sensor, you know, and every once in a while, if you do that, it can tell you a lot about your metabolic health. You know, you see how you respond to all these foods. And those are actually, they don't hurt, you know, so maybe, you know, you could probably talk your kid into wearing a continuous glucose monitor, and they have the cool app and they can see what their blood sugar is doing. I haven't done it with my kids yet, but it's actually maybe not a bad idea. Maybe I'll do it with them, but they also, I mean, my kids, you know, my kids go to the parties, they eat the stuff, but they recognize they don't feel so good when they eat this stuff. And, you know, so, and, you know, at home, we eat, you know, mostly carnivore. We eat very low carb. You know, my wife isn't carnivore, but she's low carb as well. So, you know, when we're making dinner together, you know, I cook the steak and the burgers, and, you know, they make a little bit of broccoli or a baked potato or something to have on the side, and, you know, with real butter and sour cream, and you know, you can do it as a family, you can do it for your kids, it's doable. And again, kids, you know, kids do have the buffer zone, so, you know, if they have sugar and stuff every once in a while, they're gonna be okay, because they're starting, you know, not metabolically broken for the most part.
Is it still 1 gram per pound of?
For kids, probably should be more than that because they're growing. I haven't really looked at, you know, the goals for kids, but again, you know, kids probably should be eating more protein than that, to be honest. You know, obviously they weigh less.
It's
so
easy to undereat on carnivore.
Yeah,
so
exactly.
My oldest is
Yeah, I'm sure.
cautious with her and making sure she's eating enough, so.
Yeah. Yeah. Great questions.
What would you, what do you think about like the, you know, 0 calorie, like hydration drink, like Propel?
Yeah.
What's your take on?
So, you know, the sugar substitutes in general are, I'm not a huge fan of them. They're better, so again, if you're metabolically broken and you're trying to eliminate sugar and you need that as sort of the bridge, okay, you know, and stevia is probably the least harmful one to use, you know. But ultimately, you know, the problem with the sugar substitutes, there's probably 2 main issues with them. One is that they tend to actually stimulate an insulin response, but you're not getting the glucose. So your body thinks there's sugar coming in, it starts making insulin. You didn't put sugar in, so your blood glucose drops and you get more hungry. So they've been shown to make people more hungry. And then especially the sugar alcohols, the erythritols, and stuff like that, seem to have some effects on the microbiome, which again, that's a whole nother talk and it's a whole nother topic, but the microbiome is a very important part of all of this. And some of these fake sugar products have negative effects on the microbiome. So ultimately, like I said, if you need it to kind of get you off of the sugar, you know, it's okay, but ultimately you want to try and eliminate that stuff.
So you think stevia has the same kind of effect as far as?
It's probably less of an effect, you know. I'm still not a huge fan of stevia, but there was a study on the news, you know, you might have seen a few weeks ago about stevia, and everyone was all worked up about it. And it was actually a pretty lousy done study. It was kind of ironic because, you know, a lot of us in the metabolic health space were saying, well, this really isn't a great study, and it doesn't show what they think that it shows about stevia. But, you know, either way, stevia, or actually it was about erythritol, because the news then turned it into, you know, because all the keto products have erythritol in them, this was bad, you know, keto. And honestly, you know, I'm not a big fan of the keto product, like all the stuff that's labeled keto. It's mostly processed food. The whole net carbs thing that you'll see, don't pay attention to that. It's carbs. You know, carbs are carbs, whether it's fiber or alcohol or carbs, it's carbs. And so the net carb thing is just another like food industry manipulation to be able to sell you, okay, you don't want our regular junk food, we're gonna make keto junk food for you. You know, if you're doing keto, you know, it's the principles of keto, you know, again, first rule is eat whole real food. Like, that's where this all starts. And then you can figure out, you know, kind of what mix of it you want.
Another quick question that
Sure.
coming in from some viewers that can't be here, but
Oh, we didn't know we had remote audience
yeah.
too, awesome.
the question is, how is walking more weight loss beneficial compared to jogging or running?
So, you know, probably not a whole lot of difference between the two. You know, it's moving. And again, it's moving, it's trying to move more throughout your day. So, yeah, if you spend an hour, you know, jogging versus walking, you know, you're gonna burn some more energy, but it's not that significant, the difference. And, you know, a lot of the studies show that, you know, so the studies pretty consistently show that cardio alone, not effective for fat loss or weight loss. You know, and there are a couple of reasons for that. Like I said earlier, you know, a lot of people, they do their cardio and then they get less active throughout their day. And they also tend to eat more throughout their day. And, you know, it always amazes me, you know, you go to the gym and, you know, the people are on the treadmills and they're doing all their cardio, and then they go right to the smoothie bar and they get this, like, you know, 500 calorie, you know, processed junk food smoothie. And it's like you just, you know, completely undid and more, you know, what you did on the treadmill. So those are reasons that cardio isn't effective for weight loss. Now, that doesn't mean cardio isn't good. There are other benefits to cardio, and like I said, if you got the time and you want to do both, great. But most of us don't have the time, and we need to pick one versus the other. I'm always going to prioritize the building muscle. And then, you know, your cardio can be just walking more throughout the day, you know. Go for that. It's amazing when you wear a continuous glucose monitor, you know, and you see the effects of some of these things. So I did I was wearing a continuous glucose monitor and, you know, kind of experimenting with it for social media, and I don't even remember where I have this, but, you know, I did a experiment where I ate a, you know, half a pint of the cleanest ice cream I could find. It was like you know, it was literally just like milk, cream, egg yolks, vanilla, and sugar, like 4 or 5 ingredients. And I ate half a pint of that fasted. And my fasting blood glucose, you know, which is normally about 80, 85, and I went up to about, you know, 120-ish, and within an hour was down to baseline, which is, you know, a good insulin response. Sugar comes back down. You know, I'm insulin sensitive. Then later in the day, I, you know, ate the same half pint of ice cream, But before the ice cream, I had a steak. And then after the ice cream, I went for a 10-minute, kind of brisk walk. And there was like no response. Like my glucose just stayed 85, like it always does. So activity after carbs can be very effective. Protein and fat before the carbs can be very effective. Again, you think about, you go out to eat, and the first thing you probably eat is the bread basket. They bring you that first. Or the appetizer, which is going to be some fry of whatever. And the reason that the restaurants bring the bread basket first, again, think about it. Why do they give you the free bread? Because they know it makes you more hungry, and you're going to order more food after you eat the bread. Turns out if you eat the carbs at the end of the meal, it's not as harmful. So dessert, as a concept, is less hard. If you're doing it, and again, when you look at like traditional, populations, if you just go back, our grandparents, our great-grandparents, or you go to Europe, and the more traditional things, they have that stuff at the end of the meal. It's less harmful, and it's oftentimes in their culture too that they walk afterwards. So you look at some of these populations, and you say, well, the French eat all the bread and the pastries, and the Italians eat all the pasta. Like, how do they stay healthy? It's because they do some of these other things. And oh, by the way, they're using better wheat, and they're using real butter in their croissants, not the not what we get here. And they're using the real olive oil, and so lots of that comes into play as well. Any other audience remote questions there, or are we all?
I just have a random question.
Yeah, sure.
Do you happen to know Bobby Parrish? He owns a company in Flave City, and I started following him on social media.
Okay.
And he does a lot of the very same things that you just talked about.
Okay.
So I was just curious, and
Yeah.
he happens to live in Florida.
Oh yeah, I haven't come across him yet, surprisingly.
He does a lot of the glucose monitoring, and he
Yeah.
does things where he'll eat different things to show people how your body reacts and
Yeah.
stuff. But he's all about the very clean eating,
Yeah.
more of the organics, grass-fed meats,
Yeah,
all
yeah.
that stuff.
Yeah, lots of great resources on this, so I usually, if you follow me on social media, you'll then see who I connect with and who I have on my podcast and whose podcasts I'm on, but, there are a ton of great resources. The Society of Metabolic Health Practitioners, if you guys are interested, like, you need your credits, your education credits, they put on educational programs, they host conferences. The best medical conferences I go to anymore, actually the only ones I go to anymore, because I can't stand like going to the American Heart Association anymore. The Society of Metabolic Health Practitioners puts on 2 great meetings a year. January is always in Florida, in Boca. August is in San Diego. And it's a very good mix of practitioners and just public, that's interested in this. Great meetings. There are a bunch of other good low-carb meetings or metabolic health conferences. There's the Metabolic Health Symposium, which is another great meeting, very close to where I live, Clearwater, Florida, coming up in January. Great meeting, yeah. Use your travel money and get your credits in a nice in Florida and learn about metabolic health. You can't do better than that. But yeah, thankfully, this is a growing movement. I am seeing a lot more progress on this front. I go to the meetings now, and we see more and more practitioners from more and more different specialties.
Are you finding that some of them are really trying to implement, especially
Yeah.
testing?
Yeah.
I'm talking about GPs, not just specialties,
Yeah.
but looking at how we can change our view of testing and how it's actually going to, increase people's overall outcome.
Yeah, so I think it is, there are more, practitioners of all specialties, including the GPs coming into this. The Society of Metabolic Health Practitioners has a practitioner directory, so if you're looking for like a, new primary care doctor, functional medicine doctors, I find, are more
Usually.
plugged into this than,
Yeah.
traditional MDs, but a lot of them are, hybrid and changing.
What's the
and-
website?
The Society of Metabolic Health Practitioners
Okay.
is the smhp.org. But they're a great resource. They have educational resources. They have like, handouts that you can give to your patients that explain some of this stuff, and that's a good resource. Society of Metabolic Health Practitioners, the smhp.org.
And I was just, I have a friend who shared some of her lab values, so a little bit of a case study, and if you don't mind, I can share that
Sure.
real quick. So, she, this is her, just like a cholesterol panel, but the diet she did, she was not strict, like doing strict carnivore, but